So if it feels like you are reading and reading but nothing stays in your head, I'm about to give you 5 mind-blowing hacks that can literally change how you study DA and DH forever. Like not boring theory, real hacks that actually works in exams, carving labs and Viva. Hello everyone, welcome back. I'm Ishita Sharma, a dental student and your big sis senior who's gonna help you in your dentistry journey. So, you guys were asking me like how to study dental anatomy and histology because I know this subject is little boring and you guys don't like it in the first year because you have to do carving that many students struggle a lot. See, today in this video, I'm going to tell you 5 mind-blowing hacks that will help you understand dental anatomy and histology and score good marks. Before the hacks, let me quickly simplify the whole subject so your brain gets a clear map first. See, you basically have two core books, dental anatomy and dental histology. For dental anatomy, I studied from Rashmi and Wheelers. Although here I have Rashmi. See, this book is like very good if you have language barrier. Like in Wheelers, language is little tricky. Rashmi book is very concise and to the point. It only looks big. See, once you like understand the pattern, it becomes manageable. Like in your dental anatomy, so your starting chapters is like introduction, tooth nomenclature, tooth notation system. So this is like your ABCD of dentistry. At first it feels like confusing, but trust me, like once it clicks, everything else becomes easier. See, there is not always ready-made logics. Try to create your own memory logic, your own associations, your own patterns. Don't just cram, make logics even if there are none. Okay, now like then comes your chronology, primary dentition, mixed dentition. These are exam favorite. 5 markers, 10 markers, even 15 markers. Then you have form and functions, embrasures, proximal contact areas, etc. So these are not like extra. These are the foundation. Examiner loves them. They can come in your theory, in your vivas. In vivas, that's must. And see, permanent teeth chapters are your biggest scoring zones because you're not just reading them, you are also carving them. So connect both worlds, carving and your theory. Ask yourself, what is crown form, what are the dimensions, what are the traits, variations, and like what is the function of specific tooth, root form, why is it like this. When theory plus hand skills combine, memory becomes permanent. Your muscle memory will help you to carve and also retain the things. And in your dental anatomy, then you have TMJ, occlusion, blood supply of maxilla and mandible. So basically that is your human anatomy only. So when you are doing human anatomy, you can simultaneously do this also. Okay, so it's basically nothing, just the repetition. Then you have basic physiology like your speech, degglutination, phontic, mastication, all that. See, make sharp notes for these. In anatomy, I told you not to make long notes, only make to the point flashcards or short notes. But see, in your dental anatomy and histology, you have to make notes because it's all about writing. At me, even if you understand the things, you can just write down 1 2 line is even like sufficient. But for dental anatomy and histology, you have to exaggerate things. I know, it's the truth. You can't just write 2 line and expect to get like 3 to 4 marks, unlike in your anatomy. In dental anatomy and histology, like more is less, and in anatomy less is more. Okay, so you have to like exaggerate everything in dental anatomy and histology. Now dental histology and embryology books is your Orban. This is the standard book. See, I know people like struggle in this a lot. They try to find logic, and if you go deep in it, you may find logics. So try to understand them. So see, in your starting, you have like embryology. So it's nothing. It's just the tooth formation story. It's like how your oral cavity is formed, how your like tooth is formed, what is the basic history of it, and then your developmental stages, at what time what occurs, what is how is the eruption happening, and oral physiology or like saliva, taste, mastication, degglutination, speech, everything. So it's like anatomy plus physiology. So you can relate that with your anatomy also, and your tooth physiology you need to study from Orbans. And you know what? Now coming back to your 5 mind-blowing hacks. Hack number 1. Don't cram. Build memory anchors. If you try to mug up, you'll forget. Instead, connect, relate, visualize, and compare. Turn facts into patterns. You know what? Memory is built, it's not forced. So, take slow steps and try to understand. Then, hack number 2, revision lab. Most students waste carving session. You should not, waste carving time. You should utilize it for revision. See, while carving, keep tooth theory open in your head, or you can open the book. Okay, then say this ridge is here because this cusp is bigger. Because, see, when you say because, your brain locks it faster. Try to find the, reason to it. Then, hack number 3, speak out loud. This is underrated but insanely powerful. Read, then say it loudly in your own words. You know what? Teaching mode activates deeper memory circuits. So if you can explain it, you know it. If you can't explain it, you don't know it yet. So even if you are studying alone, or you know help your friends out, try to explain them the things that will help your friend as well as you. Then hack number 4, this is contradictory to what I told you in anatomy. See, for general anatomy I told you make short notes, only flashcard, to the point thing. But dental and this anatomy, histology, embryology, you have to make full notes. Short notes are not enough. You must read book properly, then make structured full notes. See, because answer writing here needs flow plus keywords. And yes, if you want, like, I can share notes, PDFs, structured format, just check description. And hack number 5, confidence multiplies retention. If you keep saying this subject is hard, your brain resists it. So instead say this is technical but learnable. So confidence improves recall speed. This is psychology, not motivational talk. Even if you are not a dental student, the learning hacks I shared today apply to any heavy subject. But if you are in dental, this subject is your base, your visual intelligence, your clinical foundation. Master this, and second year becomes smoother. You know what? It helped me a lot. So maybe it will help you as well. So save it, share it with your batchmates, and I'll see you in my next one. Study smart, not just hard. Okay, so this was all for today. If you have any problem, or if you're struggling in anything else, do comment down. I'll try to make a video. And yeah, don't forget to brush your teeth and stay blushed. I'll see you in my next video. Bye bye.